Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCray.
You know, Tracy, it is not just women who get breast cancer. It also occurs in men. Not very often, but some 2,000 cases every year in the U.S.
Today's guest has recently completed a study of men with breast cancer, and she's here to share her findings and insights. She's an oncologist. That's a cancer specialist.
Very good.
At Mayo Clinic with a particular interest in breast cancer. Welcome back to the program, Dr. Catherine Reddy. It's good to see you again.
Thanks so much for having me.
Well, Dr. Reddy, I'm glad to hear that you're concentrating on the male population. You know, for years, the medical profession was criticized because all we studied was men. And now it seems like there are so many studies in women, which is good. But male breast cancer is still a problem. I mean, it's much less common, but men do get it.
Yeah, and actually it's interesting, the lack of research in male breast cancer in some ways mimics the problems we used to have with lack of research in, for example, female cardiovascular disease. So we need more studies in male breast cancer.
If a man has breast cancer, I would think that maybe it takes a while before it gets diagnosed, because who thinks about men and breast cancer?
And we don't get mammograms every year.
Right.
Exactly. Men are much more likely to be diagnosed with a larger tumor, with spread to the lymph nodes, even spread elsewhere in the body. And that's in large part because we don't have mammographic screening for men. So it really isn't until a mass becomes palpable that it could ever be diagnosed.
Is a lump in a man's breast different than a lump in a woman's breast? Does it feel different? Does it present differently?
Well, there's a little more likelihood for it to be close to the nipple, and so there's more likelihood of nipple involvement than there is in women.
Why is that?
Well, it's probably we don't fully know because this is an understudied area, but it in part probably relates to just the shape and size of the male breast.
Okay.
So most all of these cases are only picked up when the man discovers a lump in his breast.
Exactly.
Interesting. So, as you suggested, oftentimes they're diagnosed later and have already spread, as opposed to a female when they check their breasts regularly and they have mammograms.
Right. At least over age 40 or 50, women are recommended to have mammograms, whereas men are not.
What's the youngest male you've ever seen with breast cancer?
I've personally not seen anyone under age 40, but breast cancers can occur younger, yes.
So men should check their breasts.
Men should, especially if they have a family history of breast cancer or if they have a known deleterious mutation in one of the cancer predisposing genes like BRCA, they should at least be aware that if they do feel an abnormality in the breast tissue or see a nipple abnormality, they definitely need to get medical attention for that.
But what male would ever know that they're carrying the BRCA gene?
Well, actually, if there's a female relative diagnosed with a deleterious mutation, then the relatives of that person are recommended to be tested. So there are men
also
who know that, yes.
Yeah. Sister, mom, grandma.
Exactly.
Is it more common than it used to be, like other breast cancer?
Male breast cancer incidence may be increasing in some countries and not in others. Studies have been a little mixed in terms of what's happening with the incidence. The major issue isn't so much that we have a skyrocketing incidence, but more that we don't have studies that inform optimal management for these men.
But you have a study.
We did just complete a study. What I would love to have, what I don't have, is a clinical trial yet. The International Male Breast Cancer Research investigators would love to be able to launch a clinical trial to really understand what is the best treatment. The study we did was using National Cancer Database information to understand how are men being treated, how are men doing right now with the treatments we have. But it isn't a clinical trial where we were able to randomize men to one treatment or another.
You know, you talked about in your study that you studied men with stage 1, 2, or 3 breast cancer. Tell us what those stages mean. And are there 4 stages and you didn't study those men, or?
Yes, there's actually, in some ways, there are 5 stages. So stage 0 breast cancer means it's not invasive breast cancer. This is not possible. It cannot spread elsewhere in the body. And so that's kind of a different type of breast cancer than the invasive breast cancers that we think of with stage 1 to 4. Stage 4 breast cancer is cancer that has spread elsewhere in the body already. And so in general, we cannot cure that. We control that. But we focused on stage 1 to 3 to understand the curative intent management of male breast cancer.
And tell us what 1, 2, and 3 mean.
So stage 1 versus 2 versus 3 basically relates to how big is the cancer in the breast, has it spread to lymph nodes under the arm, and then our new cancer staging, which is relatively recent, also takes into account the biology of the cancer. So it's a kind of complex algorithm, probably difficult to explain on the radio, but
The biology of the cancer, meaning how nasty it looks under the microscope.
and whether it's hormonally sensitive, whether it overexpresses a receptor called HER2/neu.
So those are the same in men and women, ER, PR, HER2?
So men's cancers, interestingly, are more likely to be hormonally sensitive than women's cancers.
Interesting.
Why? That seems unusual.
We do not understand why, but it's been pretty consistent across all studies of male breast cancer that there's a very high rate of hormonal sensitivity in men's cancers.
Tell us more about your study.
Well, we were able to assess, and I worked with multiple co-investigators on this. Dr. Sid Yadav, who's one of our fellows, was actually the lead author on the study. We were able to assess nearly 11,000 men who were diagnosed in the United States and whose cancers were captured in this national cancer database. This includes more than 70% of all the cancer diagnoses in the U.S. and includes cases diagnosed at more than 1,500 sites. And by looking at how these men were treated and how they did prognostically, we were able to identify some disparities and some predictors of better and worse prognosis. We were reassured that it looks like the treatments that men are getting are improving their prognoses. So we found that men who had received chemotherapy, men who had received endocrine therapy did do better. And that's reassuring because, as I said, we don't have clinical trials like we do in women to say certainly that, yes, this is beneficial versus not in a man. So when we really are left with this kind of data to guide our treatments.
Which men had a worse prognosis?
Unfortunately, non-white men had a worse prognosis. So there were sociodemographic disparities, basically men who had fewer financial resources based on variables that we use to determine that. And unfortunately, that's consistent across in female breast cancer. Also, we tend to see that there is a relationship between financial resources and better prognosis. And so certainly older men also seem to do worse. So there are some areas where we think we'd be able to identify need for intervention and maybe gaps in care that we could address.
Do you recommend if a man has got a history, a sister or a grandmother or something, do they need to have mammograms? Do you give a man a mammogram?
Interestingly, guidelines
Too
from
painful for a man to tolerate.
Listen, small-chested women understand trying to give a man a mammogram. That's all I'm going to say about it.
if a man, family history alone is usually not enough reason for a mammogram, but if a man, there might be certain circumstances where this should be discussed, depending on how extensive the family history is and what the whether a genetic mutation, a deleterious genetic mutation, is known in the man. There's a lot of need for national guidelines that are specific to male breast cancer, and the American Society of Clinical Oncology is working on developing more in-depth guidelines for men.
What about prognosis and overall survival, men versus women?
Well, when you take all male breast cancers and you compare them to all female, because these tumors are larger and more likely to have spread, there is a worse prognosis in men. But it doesn't appear that when you control for all the other biological variables that men are doing any worse. In fact, some studies have suggested that perhaps the prognosis may be a little bit better in a man with the exact same stage and biology of disease.
So pretty much about the same.
Approximately.
5-year survival for men?
Well, so that's so dependent on what is the stage, and so it's not lumping all male breast cancers together is not, it's hard to prognosticate without knowing an individual situation.
All right, well, only 1% of breast cancers occur in men, but it's just as challenging to treat as the same disease in women. The overall survival for men with breast cancer, about the same as women, but the prognosis is worse for non-white males and also men who live in low-income areas. But there is hope for the future, and as you said, we're doing better with treating male breast cancer, just as with women. Our thanks to Mayo Clinic oncologist, Dr. Catherine Ruddy. Thanks so much for being with us.
Thanks for having me.